Good afternoon, everybody. We wait a couple of minutes and then we start with our webinar. Okay, great. I see people coming in. So I would start. So my name is Chiara Davalli. I am project manager at EBN, European Business Innovation Center Network, one of the partners that are part of the CHERRIES team. So my role is to welcome you to this first episode of the CHERRIES Webinar Series dedicated to exploring responsible healthcare ecosystems in Europe. This is a journey we want to take you on with us for 4 weeks, starting today and ending in mid-October. And indeed, here you can see the full picture of the World Webinar Series. And indeed, we start today with a very interesting talk on the role of need in open and user-led innovation approaches in the healthcare sector. So together with me, actually, on the conversation is led by Wouter Boon from the University of Utrecht and Miriam Martin from TIC Biomed. But before we enter into the discussion and into the juicy part of this webinar, I would give the floor to Stefan Philipp, who's the coordinator of the CHERRIES project, to give you an introduction about the project. Then, indeed, I will tell you also, I would also tell you a little bit right before giving the floor to Stefan, sorry, I would inform you about the fact that this webinar is recorded. So we are recording the session, and the recordings together with the presentations of all speakers will be made available on our website. During the session, you can interact with us and the speakers by raising questions or comments in the chat box you find on the right of your screen. Please write there your comments and questions. We'll be collecting them, and we'll run a Q&A session at the end of the webinar. So I'll monitor that chat closely, and I'll make sure your voice is heard. So I now give the floor to Stefan to tell us about CHERRIES.
Yeah. Good afternoon, everyone. My name is Stefan Philipp. I'm a project manager at the Center for Social Innovation. We have the pleasure of coordinating this project, CHERRIES, Responsible Healthcare Innovation Ecosystems. It's an RRI project in the context of the Science for and with Society program by the European Commission. Yeah, it's as well as 14, so territorial perspectives of RRI. Next slide, please. What are we doing in CHERRIES? I would just want to make it very brief. It's RRI-based experiments in the healthcare sector based on open innovation and co-creation approaches within the sectoral R&I systems of these regions. We start with a stakeholder-based need identification, selecting, the core experiment is starting with that, with this need identification, and we select needs for funding. And then we make sure that the selected solution provider goes to a co-creation process with the organization who has this need in order to make sure it fits really the need and it's a well-developed solution. In parallel to this core experiment, we are monitor as mapping and analyzing the research and innovation systems of the regions. We are monitoring and evaluating these experiments, and based on the results, we give recommendations for the design of responsible and demand-oriented innovation policy mix in the territories. Next slide, please. Why are we doing this? The healthcare sector is not only in this time, but in general, it's a sector that is under pressure. We have the societal ground challenges of demographic change and aging. The older population has more chronic diseases, comorbidities. We see trends like personalized medicine and other things that are really putting pressure on the healthcare sector. And in order to increase the quality and keep the costs under control, innovation is more and more seen as a critical factor for meeting these needs. Yeah? And at the same time, it's obvious that healthcare innovations often are not uptaken as much as they should be. And that's why this need orientation, co-creation, RI approaches are seen as a way forward to actually help these innovations to establish themselves on the market. Next slide. And just very briefly, who are we? We are 12 partners, 7 European countries. We have a very good interdisciplinary and transdisciplinary mix with SMEs, research institutions, a university, the public authorities, a hospital, and civil society organizations are on board. We are doing these experiments in 3 regions right now. It's Murcia in Spain, Örebro in Sweden, and the Republic of Cyprus. In all these regions, we are working with the stakeholder system, so it goes beyond the organizations that are depicted here. And something that probably we can discuss in the Q&As is within the project, we will spread beyond those 3 regions, and we'll start to build a community and give knowledge and know-how about these experiments to other regions that can apply for these processes. And that's CHERRIES in very brief. I don't want to take more of your time. You see my contact details here. You can go, get in contact with us anytime if you have any questions about the project or about the community. But without further ado, I would really like to give the word to Wouter and his presentation about the role of needs in health innovation. Thank you.
Is this visible now, or? Oh.
Yes. Yes, perfect.
Are you able to see this?
Yes.
Yeah. Okay. That's okay. Thank you very much for having me during this this presentation. Are you still seeing the slides, or? Okay. Yeah, so thank you very much for having me. My name is Wouter Boon. I work at Utrecht University, the Innovation Studies Group, and I'm very honored to be presenting for the CHERRIES project because it's indeed a project that is you know, close to my heart, as I'm also have been doing research on needs and users and demand-based innovation, especially in the context of healthcare and life sciences. So that's very much what I like to show you as well. I have worked at several Dutch universities and also at a technology assessment office here, but now work at Utrecht University on topics like demand articulation in emerging technologies, user-driven innovation, public-private partnerships, etc., etc. All the things that are you know, close to the CHERRIES project as well. You might know, and which is probably also the starting point of thinking of CHERRIES, is that in innovation studies, innovation policy studies also, the idea of innovations following a linear pattern has been, very prominent for the last couple of decades. So we have basic research, and then applied research, and then knowledge turns into more technological development, and in the end, the knowledge and also the innovations that come out of that they will enter. They will in the end come to the consumer that will use it. So you have science finds, industry applies, and man conforms kind of order. But of course, we also know in the last couple of decades of innovation studies that most innovation processes do not follow this linear model, but a far more iterative model with lots of feedback and feed-forward loops. That's exactly also because since then there has been a lot of research also on the other side, so not the technology push side of the innovation process, but also on the demand side. So why is demand side interesting to study? That has been something that is in the focus since the 1970s, with the work of especially the work of Sprue in the UK, Rodwell and Freeman, but also Toybal and Pavitt, especially the SHAPO study, in which they looked at twins of innovations that are successful and that they compared with innovations that were not successful. So the success versus failed cases, and then looked what conditions actually were influencing success, innovation success. And one of the most important explanatory variables was that user needs were better understood by people behind, or in project teams behind the successful cases. So that's one indication that user needs should be understood better, and also that there should be more emphasis and understanding of the demand side of innovation. And of course, and that's also very important, but also probably also well-known name in this type of research is the name of Erik von Hippel, who then began to study that also not only listening to users is important, but also that users themselves can be innovative by themselves. So, and he looked into this in several sectors, ranging from industrial products to consumer products, like outdoor consumer products, extreme sporting equipment, mountain biking, etc. But also in fields like surgical equipment, and even pharmaceutical. In the pharmaceutical sector, the role of innovative users became apparent. So this resulted in all kinds of user innovations. So these are some examples: desktop publishing, the sports bra, and also email can be seen as examples of user innovations. Yeah, so there are multiple reasons to involve users, not only for their information about their needs, and also because they are innovative, but also more broadly. And these are 6 reasons to involve users. One of the reasons is that they can that they have a creative potential by themselves. So this is again these innovation, user innovation idea, the idea that users by themselves can come up with ideas for product developments or incremental developments of products. So they have, based on their experiential knowledge. So for example, here you see a picture of patients who are discussing a new product in a particular for a particular disease, and they discuss what could be changed about this product. But also, and that's the bottom right example, in this COVID-19 times, you also see all kinds of other users, not only patients, but also, for example, medical professionals or medical technicians coming up with all kinds of novel ideas or idiosyncratic ideas. This is an example of a decathlon kind of diving mask used for people working in intensive care units in hospitals as a way to circumvent shortages in medical masks, facial masks. So that's an example of reasons to involve users. Another reason is that if you involve users, then and especially if you involve users in a very early stage, then, and that's also the reasoning behind responsible research and innovation. If you involve them very early, then you also make sure that they have their buy-in into your product, so you have a higher chance of implementation. That's actually the next thing. But the previous thing is also they can also, apart from providing all kinds of knowledge and all kinds of novel ideas, they can also make the R&D process itself more efficient and more effective. So one of the examples is patient organizations trying to co-create or co-produce clinical trials or make them or get the organization more efficient. So in order, for example, in terms of patient recruitment, that's especially prominent in areas in which patients are very rare. So the rare disease field, you see this very heavily, but also patient organizations organizing, and that's the example on the right, organizing scientific workshops in which they let scientists discuss novel science, so to say, but also have their patient so in that way make the science and innovation process more efficient, and at the same time controlling it a bit more. Another example, a reason to involve users is indeed what I said, to have the chance of implementation, to increase that based on this early inclusion, and also hearing all kinds of anxieties of users earlier in the process. This is an example of a study we did on post-market surveillance of medicines and vaccines in the pandemic crisis, the Mexican flu, actually a couple of years ago, but also examples we studied in HIV/AIDS, in which medical specialists and nurse practitioners and patients together formed all kinds of idiosyncratic post-marketing surveillance solutions. And by doing this, increased the chance of implementing these medicines. Another reason for involving users is that they give you an idea of all kinds of societal, ethical, and legal issues in an early stage. So again, patient organizations being able to advocate but also articulate their anxieties, and in this sense make the societal debate and ethical debate more richer, actually. The same goes for these patients or other users in the healthcare field, formulating a response to market failure. So for example, this World Health Organization report on essential medicines was co-created actually with patients, and set out a research and innovation agenda for particular diseases, but also what should be investigated inside these disease fields, and in this way incentivized all kinds of other actors in the healthcare fields, such as governments and research councils, to direct their innovation and research efforts better. In that sense, It's also a demand articulation exercise. It has been a demand articulation exercise. And the last reason to involve users is a bit more soft, but it's also that innovation, especially in the healthcare field, takes such a huge presence in people's lives that it's also something that people and especially patients, but also medical specialists, should have a say about. So democratizing innovation is again a bit softer, a bit an overarching kind of reason to involve users. And users can be involved alone, so as individuals, but also as collectives. So you also see lots of user communities. I mentioned these patient organizations, but there are also all kinds of other user collectives, especially online. So digital platforms, digital communities that create innovations together. The most prominent example is, of course, open source software, but also in the field of healthcare, you see these kind of things happening. So I explained why we should look at this demand side of innovation, and also why we should take these users serious. But then, of course, you also might want to ask the question: okay, why? How should we go about? So how should we incentivize this through, for example, innovation policy and innovation policy instruments? So why should we focus on the demand side in the sense of innovation policy? There are multiple reasons. The aim is to, or there are multiple aims actually to do this. So first, of course, is to increase demand for innovations, so you can create markets for innovations as a policymaker. But you can also steer the functional requirements that innovations have. So to steer for more novel alternatives, or to steer for alternatives that are in line with certain missions, for example, or certain societal challenges that should be addressed coming from a policy perspective. And the third reason might be to improve user involvement, in the sense that it also might democratize innovation. We talked about this before. There are also underlying rationales to look at the demand side, because there are market and systemic failures happening. So, for example, there are first mover learning costs. So people that come with a very innovative product on the market, they are engaged. They need to engage with learning. They need to make sure that the users, but also all kinds of other actors, such as regulators, learn about these new products. And this involves all kinds of costs, learning costs, and they are actually taken by the first mover, the first innovator, so to say, and that might disincentivize these first movers to go first. And you want, as a policymaker, to circumvent this externality, more or less. There are also an example of systemic failures, the information asymmetries between users and producers. I know that CHERRIES is also looking at need articulation and demand articulation. You want to know what the exact demands are by users in order to, and also align them with what producers are working on. And that is sometimes not in line, misaligned, so to say, and you want to increase this alignment, and that's also calls for policy interventions. There's a second group of rationales that's a more economic, focused on economic growth. If you want to incentivize particular innovations in particular sectors, and also want to stimulate these sectors and create lead markets, then you can also focus on increasing the demand to help these particular sectors become more competitive, especially vis-a-vis other countries. And the third, and actually growing rationale to look at the demand side, is that there are grand societal challenges and missions that should be solved. So these societal goals are more and more prominent in, of course, the European Union Horizon 2020 research agendas, but also in national agendas in Sweden and in the Netherlands and in other countries, they become more and more prominent. And this is also an example of demand side rationale why innovation policy should look at this demand side. There are three challenges with demand side innovation policy, though, and all of them are, I think, relevant also for CHERRIES. The first one is a demand articulation challenge, because for some innovations, some innovations exist already, and some innovations are on the wish list, so they are emerging or they should be developed. And at the same time, you also have the situation that needs are very well existed and very much articulated, whereas other needs are in development or are emerging. And so you can have of course, this 2x2 matrix that we thought about in an article together with Jacob Edler, in which you have all kinds of different ways or different states actually of what should be how you should think about demand articulation and market creation. Also different kinds of things that you should pursue in these different situations, and also that these different needs and wants, either emerging or already existing, that they should be translated. So they should be translated into demands, and then should be translated into a demand policy wishes, and then of course translated into all kinds of demand policy instruments. And then of course you hope that these instruments have an effect in terms of output and outcome. But this articulation is also a way is really a translational kind of exercise in the sense that that sometimes demands are, or societal demands are, quite vague, and they should be of course also converge or should be made more explicit, in a sense that more concrete companies can also, or other kinds of innovation developers or scientists can address them. So it's also a question of demand articulation is also a question of articulation and specification. Go from very broad goals to very specific needs, so to say. A second challenge is, of course, an instrumental or procedural question: is how to involve, how to do this co-creation. That's also very close to what CHERRIES is trying to do, of course. But questions like how to set up a co-creation process, who to involve, how to ensure that those who are involved have equal contributions in terms of power and also in terms of content, what they bring to the table, so to say. How to ensure that maximum creativity is ensured in these co-creation sessions, and also to ensure that things that are happening inside these co-creation projects, that they are more or less protected against all kinds of existing rules and regulations that might inhibit all kinds of creative ideas from the early start. So you need to protect these creative things a bit early on, and let them blossom a bit before they become, before they will be scrutinized by existing institutions. And that's actually also the bridge to the third and final challenge, is that if you have a very nice co-creation project and there is a nice solution or innovation coming out of that, then of course you need to make sure that you create also an alignment with existing institutions, so existing regulations, but also existing norms, and ensure that these ideas are also, or these innovations are also more or less legitimized, and in a sense also is that a precondition for wider scale up and a wider formation of markets, regimes around that, rules and regulations, and in a sense that also is in a sense there is also activities needed. There are market formation activities, but also institutional entrepreneurship, in the sense that that institutions are not simply there, but you can also, as an entrepreneur or in a co-creation project, aim to innovate these institutions in order for them to be more aligned with your ideas. So these are 3 challenges, maybe also challenges for CHERRIES, by the way. Hopefully we can discuss them later during this session. And with this, I want to finish my my presentation. Thank you for your attention, and I'm looking forward to your questions and to Miriam's talk, of course.
Thank you very much, Wouter. Thanks a lot. I think you gave us a lot of interesting inputs for the discussion, and of course for CHERRIES project and activities. You touched upon a series of sensitive aspects of the co-creation, let's say, methodologies, the ORI responsible innovation framework. So very important inputs for us, and I hope also for the participants. And I think that Miriam is going to already start reacting to some of your inputs in her talk, because she's actually going to tell us a bit more about the experience of TIC Biomed and in the in-demand project, on how they are addressing indeed the role of need and user-led innovation in healthcare. So Miriam, floor is yours.
Okay, thank you, Chiara. Wouter, I should say that we haven't met before, but I quite like your presentation, and I'm quite happy to say that it is quite aligned with what I'm going to present now. That is a real experience that we have had through an EU project called In Demand. So my name is Miriam Martin. I am head of project management in TIC Biomed. And TIC Biomed is a cluster organization. We are based in the southeast of Spain. And our role is bridge the gap between healthcare organizations and companies. This is to really support companies to get in touch with the healthcare organizations, but also healthcare organizations to understand a little bit better what the companies, how they act. So that is our main role, and that's why, or how we got involved into all these need identification and co-creation activities. So I have to say that we really have the technology. So we really have the technology to make healthcare simply accessible for anywhere. But prior to moving on to this technology, we need to identify which are the main priorities, because there's a lot of technology. I mean, all companies are developing technology. It's usually been a sector, the healthcare sector, where it's been technology push. Means like companies were developing solutions and offering those solutions to the professionals without really paying a lot of attention to the needs, to the priorities within the healthcare organization. And aligned with the Wouter presentation, for us, users are not only final users, but are also the professionals. Healthcare sector, it's a little bit complex when it comes to identify who is the decision maker, who is the payer, who is the user, who is taking the decision. So here we've been working with healthcare professionals, and we've been really trying to identify or set a methodology to better identify the main priorities. But not only that, needs identification, it is the first step in a long process. So working from the needs, actually what means it is a change in the management. It is a change of culture within healthcare organizations. So we have identified some key issues and that we have to pay attention to when working in co-creation or demand-driven co-creation with healthcare organization in a regional context. All these conclusions came, as I said, from the in-demand project, but also because as TIC Biomed, we work a lot with healthcare organizations, with regional healthcare systems. So we've been implementing this initiative, and these learnings are real learnings. So the first thing is we really have to secure the innovation culture. We need to keep changing the innovation culture within the organizations for everyone to understand that move forward in innovation is really a key step. Then we really need to set a bottom-up approach. We need to count with the users. As it was explained, it is not only supply side innovation, but also take into consideration the demand side. And obviously align all that with the healthcare management. So we combine both the bottom-up approach and the top-down approach. We'll see later on why it's so important to pay attention to these issues. But also, we set demand-driven co-creation. So we really designed a methodology for the companies working together with the professionals developing a product. By doing this, it is important just to spend the public funding in a more efficient way. If we work demand-driven, that means that we are really putting the public funding in those areas that are of the interest of the professionals, but also of the top management. And last but not the least is we really need to set a solid ecosystem network, because it is really the basis of let's say, of an innovative ecosystem environment. So first point will be secure the innovation culture. As I said, most of the innovation has usually came, or especially in healthcare, came from companies. They were developers, they were offering what they had developed, without really understanding or paying much attention on the needs of the healthcare organizations. Having said that, it wasn't their fault. It was because the healthcare organization hadn't really set a formalized process to identify which were the priority areas or which were the needs. So what we've been trying to do is to set the processes, the right processes, to secure that there is a process within the healthcare organizations that support professionals to show their ideas. So how to manage the change? As I said before, working from the needs, it is not something that comes out of the blue. It's a part of the whole process. So the first thing is the need has to be identified bottom up. It comes from the professional, it comes from the users, or both combined, users and professionals. But those are the ones front line that knows what is really going on, which are the real needs. Then we need to prioritize all those needs from the management, because on the one hand, there are some policies that we need to follow. On the other hand, there is available funding. And thirdly, we need, or we really want the management to be fully involved in the whole process, because the logical, let's say, we'll see, it is to reach the adoption. It's like once we co-create a solution, once we identify the need, once we start working with that concrete need, we really want to procure, or to have a procurement, and to really start working with that need. So prioritization and involvement of management, it is pretty important. Once we have the idea and the management, we do an evaluation of the ideas proposed. As an example, we launch here in Murcia a call for needs among the healthcare professionals, and we think that we were really successful, because in 1 month we received 68 needs. Those needs were evaluated and they were selected, and finally we selected 4 of those 68 needs. The criteria we used, it was quite wide, but we really pay attention to, well, obviously the policy priorities, but also the IT systems, how easy it was to plug the solution within the actual or the existing IT systems within the healthcare organization. also how feasible it was to develop, because our co-creation was going to be done in 10 months. So the solution should be able to be developed in a period of time, and also with a limited amount of funding, because we funded 40,000 euros per solution. So we did this, we selected the need, we launched the call, and we selected 4 companies able to develop those solutions. And then we started the co-creation, and we created mixed teams between professionals and the companies. And they were working together for, in one case, it was 6 months, and the other case, it was 11 months. So, and they were working together. And the experience was amazing, because companies were really pivoting. They were really changing the ideas that they had in mind, or the preliminary ideas they had, as they start talking with the users, with the patients, and with the professionals. One thing that is really important is to have clear KPIs, because the whole idea is to develop value-based solutions. It's really to have really valuable solutions. So you need to define clear KPIs at the beginning of the co-creation, just to make sure that the results you are achieving go towards the goal that was set at the very beginning. And the last step, let's say, of this change or management change, it is the adoption. And it was also mentioned before, we need to adjust the legal frameworks to this innovation, to these new innovative processes, because you do the co-creation, you end up with the co-creation, and it should be possible, or it should have been possible to adopt directly the solution that has been co-creation, because it has been successful. But with public procurement, it is not that easy. So we'll see now how we are working on those different steps. So this is the process that we designed to be able to introduce the change within the organizations, and the different steps to follow. And as I said before, what we set up was a bottom-up process. We really started the house from the ground, let's say, and we involved the professionals into the identification of the needs. So which are the achievements, or which are the really good results we found? In the first place, we involved the professionals. This is to say, like, you have a say. You really can contribute to the innovation within the healthcare. You can facilitate the introduction of digital health services within the healthcare organization that will provide better service to the patients, but also may also increase the quality of your work. On the other hand, this process of need identification allowed the identification of talent, allowed the identification of this creative professional, this innovative professional that there was, I mean, they were in the organization, but they were not identified. And thirdly, it motivates the professionals, because they feel useful. They feel that they are able to contribute to the evolution of the introduction of digital health services, but also to improve the quality of the service within the organizations. But there are some challenges as well. So we are quite happy with the results. We received pretty good feedback from our professionals, but there are some challenges. And the first thing is we need to explain really well what is the need identification process, and the professionals need to understand what is the need identification process. So it is important to organize sort of workshops or seminars and really create the clear expectations on what this is and what it is not. Like, what are you going to do with this, and what it involves? What is going to be the involvement in terms of hours if you are co-creating with the company? So explain really clearly which are the rules of the game. On the other hand, another of the main challenges it is that the way it is, at least in Spain, and I think it happens all over the world, like the professionals, the main task of the professional was taking care of the patient. So by asking them to provide need, but also work together with the companies, you are allocating new tasks for them. So you also need to allocate some time for them to devote the concrete time for the companies, but also for the management, because the management has usually been working technology push. So by working from the need, that means that they need to have some criteria, for example, for the evaluation of need, or set some internal processes just for the need identification. And there is another challenge that it was pretty important for us, and it is how to transfer the needs to the suppliers. Because when you gather all the needs or you launch a call for needs and you gather all the needs from the professionals, the needs are described from the professionals' point of view. So they say what they want to, which is their main concern. But if you want to move that need to the suppliers and you want to launch a call for solvers or a call for solutions, you really need to, let's say, translate those needs from the language that professionals have used to the language that the companies will be able to understand, especially when it comes to IT requirements, for example. It is, I mean, you need to be really clear on what the need involves, what you really have in mind to develop. So those are the main challenges working with this bottom-up approach. Thirdly, the third area that we mentioned was the alignment with the healthcare management. And as I said, this is really important because there are some policy priorities, because there are some funding that requires or sets some requirements in the use, but also there are some IT requirements within the organization. So, and finally, the most important thing is if the initiative comes from the top management, that gives credibility, that gives back up the idea and increase the motivation of the professionals. So as I said, we really need to combine both the bottom-up and the top-down approach. And finally, and the most important, as I said before, the main objective of the whole co-creation project, it is the solution to be adopted by the healthcare organizations. So you need the healthcare management to be there from the very beginning to take the decision on which are the important needs. Because then if you have to launch a procurement, you need them to be behind this procurement. It is also really important to have the idea of demand-driven co-creation as a way to explore. When Walter was talking about co-creation, I was not quite sure if it was co-creation in the definition of the need, that it is possible, or co-creation in the development of the solution. The way we have used co-creation, we have used co-creation in the development of the solution once the need was already identified. And we need to understand co-creation as a way to explore, but it is an exploration in quite an organized way with a prioritization process. So there are no, let's say, big mistakes. The things are not done right or wrong. And as I said, you just need to explore and to find different ways of doing that. Our experience with some companies, it is they were selected because we really thought that the proposal was brilliant and it really fit with the need that we were launching. But when they started the work, they realized that their idea didn't really match with the need that we published. I mean, sometimes that happens, but they were able to really pivot and then modify the whole concept of the solution and adjust it to the professionals. And they say that they learned a lot, that for them was really a good experience and allow them to understand better what the professionals are looking for. So by mixing this top-down, bottom-up, and also the suppliers' approaches, that makes easier to move towards the transformation and improvement of the healthcare organizations. One point to be considered, it is the definition of the KPIs, because we need really to measure all the results and identify which are the successful solutions, because the ultimate goal, it is really the adoption. Spending public funds, my advice is mainstream the use of demand-driven approach, especially when the health faces actual challenges. We have all seen lately with the coronavirus outbreak that we have had a lot of calls focused on coronavirus. If you have a concrete challenge, go for it and really use your funding from a demand-driven approach, because the use of funding is going to be more efficient. And lastly, the ecosystems are really the basic stepstone. Healthcare organizations themselves are not able to do it. They need support from some other actors within the ecosystem. The main challenge is that the ecosystem is not evidently in place, but you need to look for roles, not for organization. In your ecosystem, just look for who is going to be able to provide business support, who is going to be able to work with professionals, with patients, who is the one that has the money in your region. So it is not the organization itself, it is the roles, and look for the different organizations with the roles that will help you to build like a sound ecosystem. Also consider that there is a wide diversity in regional setting and context. I mean, what we have learned is like we can't do the same in all different regions. We need to adjust all the different experiences. And also there is a lacking of networking between ecosystems. I mean, sometimes you have ecosystem, but ecosystem work as a silo, not only at the regional level, but also European level. And in that sense, I must say that we are really proud of what we achieved in demand, because we managed to create what we call the demand community. The demand community, it is consists in 12 regions from all over Europe. You can have a look here to the regions, and we are working together with the in-demand regions, Murcia, Paris, and Oulu, just to set up this methodology. They all have been launching calls to identify the needs and launching calls to identify solvers or companies able to develop a solution for that need. And I know time is short, but I just wanted to end up. I have mentioned in demand quite a few times. As I said, it is a European project. We have developed all the methodology, and all the findings that I have presented comes from our experience with in demand. And what we have done actually is just identify the needs with the professionals, look for funding for the innovation, and then solution development through the co-creation. And what we are going to do in CHERRIES, it is a similar process, but we are going to include in the need identification process not only the professionals, but we are going to open that to the society. And also we are going to pay more attention to responsible research and innovation. So I'll be really happy if you follow CHERRIES in demand. It's nearly finishing. If you follow CHERRIES, because I'm sure that we will find out new insights on how to improve the process. So thank you very much. And I'm really sorry, because I think I was a little bit longer than expected.
No problem. No problem. Thank you. Thank you very much, Miriam. So before I start commenting a little bit some aspects I noted down for this part of the session, I would invite participants to raise your questions in the chat box. So I was thinking that we are very lucky in CHERRIES to be able to rely on the experience of TIC Biomed, so Miriam and her team, that indeed made a lot of made a huge experience with the in-demand project. So as you could see from her presentation, it was all about co-creation processes, how to shape new innovation policies within healthcare organizations, and through the involvement, by involving the professionals from the very early stages. So I mean, from the definition of the needs within the organizations. And I have a question for you, Miriam. I was wondering, so indeed, what comes to my mind is that despite you define it very clearly across the 6 axes, 6 main aspects you need to take into account when designing and developing these co-creation processes. So my question is, how do you coordinate all these? So do you need an external actor like TIC Biomed or the in-demand project to run this type of approaches, or can organizations do it by themselves? You are presenting the in-demand community, so the 3 regions that were the pioneers of the world methodology, and then the others. So I was wondering, how is this process implemented? Who's leading it? Because putting together all these actors, I think it's quite challenging in itself.
It is, but let's say that you have to do it step by step. And it was the last point, and I know the 4th webinar, it is going to be focused on ecosystems, and we will count with Annette, and she knows this really well. So that's why, although it was the last point, it is really important to set an ecosystem. It's like healthcare organizations themselves, they are not able to do that. Patient association, they are not able to do that. So you really need to put together different stakeholders with different capacities. I mean, they might have like a business support or funding capacity, or maybe they could have, yeah, I mean, obviously like a healthcare organization, you need like a demand side organization. But I mean, you could do it, but I think you really need to put different strengths together in order to be successful. It takes a little bit of time to understand each other because we all have like different speed, but it really works. And I mean, we are like not only the 3 in-demand regions, but also the in-demand community regions. They've all done it like in different ways. It is amazing. I mean, it's like, and I'm sure if we had more regions, it would have been the same, because sometimes healthcare organizations have got innovation funding. Some other times, regional development agencies have got their own business support team. So there is a wide variety of roles playing in a region or a country. So for me, the important thing is, which are the capacities that you want? Look for those organizations and then put them together with a common goal. But it is not one typology of organization. It's like different roles.
Yeah, thank you. Yes, indeed. That's what you were also expressing before. Yes, and okay. I'm trying to copy paste a question we just received on our chat. Sorry, so that I can show it to both you, Miriam, and Wouter, for you to answer this question. So Barbara is asking, do you think demand-driven webinar can become the default in healthcare, or is it an add-on also regarding budget that are spent on demand versus supply-driven innovation?
Well, this is if it is on my wish list. I would love that healthcare organizations pay more attention to demand-driven, not only from professionals,
Innovation.
but also
Yeah.
from patients. Because, I mean, it is going to be more useful. The thing is, you really need to change the processes within the organizations. And that usually goes like a slow pace. I mean, that is it should be, it's changing slowly, but surely. And to be honest, this coronavirus outbreak has really given a huge push into this demand-driven approach. It's like, okay, we really need this. It's like, this is what we need, so focus here and just forget. It wouldn't be like 100%, because you always need to keep evolving in some areas, even if there is no concrete need. I mean, you might need to create the need, but my wish, if I could have it, is really to move towards this demand-driven process approach.
Yeah, and also to add to that, I think that that there is, demand-driven innovation is always there. For example, if you look at cases of German surgeons, they have 25% of all kinds of new surgical tools are coming from surgeons themselves, and you can have all kinds of these kinds of examples. It's probably more the challenge is probably more the scale up, or actually what Miriam explained, the way you translate actually all these nice ideas, these demand-driven ideas, into concrete prototypes, but also products that can scale, or at least can align to practices, and also not only in particular localities, but also in other localities. So it's also involves probably sometimes commercial routes, but sometimes also other ways of decontextualization and recontextualization in other contexts and localities.
Yeah,
and also you need to consider, sorry, Chiara, this institutionalization challenge that it was presented. It's like it is not only the change in the organizations, but also some legal aspects that you need to change in also to move everything. It's not everything, but a high percentage into need identification, co-creation process, and adoption. So yeah, but we are in the right path. So that's we just need to move forward.
Yes, Miriam, you anticipated me, so I want to say the same thing. And I have another comment coming from Claudia Colonnello. She's saying that the issue of the driver of the process is very important in innovation output as building of a shared vision within a coalition of relevant actors. So I think she's pointing out, yes, about the driving forces of these innovation processes. Yes. And I don't know if you want to comment upon this aspect.
No, I mean, I just want to say that, as I said, the driver could take any or could be of any nature, because it could be a cluster organization, it could be a healthcare organization, it could be like a central procurement organization. So there are a lot of, even in CHERRIES consortium, there are like a lot of different profiles in the same consortium. So, but yeah, you really need to have a driver, and you need to have someone really pulling from the methodology, and believing that it is worthy to do. But having said that, you need a driver. But if you motivate the professionals, or you motivate the patient association, or you motivate, that really make it like a more credible, or you really feel that you are part of something.
Yeah. Wouter, do you have any other comment?
No, I think this is also at the same time, it can also be a coordination question. So who is going to take the lead? And that might sometimes be through all kinds of very, very good initiatives like I think like Cherries or like In Demand. Sometimes this driving and also the vision or shared vision making is probably also a challenge in itself. But that's maybe a bit of an obvious remark. But yeah.
Good. Stefan, do you have any question, comment for our speakers, for the audience?
Yeah. Thank you. First of all, thank you both for your very nice and interesting talks. One question that is still, when I'm coordinating CHERRIES, we are thinking about this process since more than a year now. One thing that is still puzzling me every now and then, and we are discussing this question regularly, is after this co-creation process, you have a pilot, you have this, use this analogy of a beautiful monstrosity. How can you facilitate, as an organization, as an ecosystem, how can you facilitate the adoption or the market creation of these things? I mean, I know in like a week or in 2 weeks, we're talking about public procurement as a tool. What kind of strategies could an ecosystem use in order to help this new innovations at the market?
I think we are moving forwards and we are evolving, but as I said, one of the biggest limitations we have, it is the legal framework. It's like you can't procure, I mean, you have co-created something, but due to the public procurement regulations, you can't procure that concrete issue. I mean, you have to launch a call for procurement, and then many other companies could submit a solution, and the one selected, maybe it is not going to be the one that has developed or has co-created the solution. So I think there are like some changes in the procurement and innovative procurement, and I think, I mean, the talk on next 2 weeks, the 4th webinar, Chiara, that is going to be pretty interesting, because Oulu has really managed to develop co-creation and evolve into the adoption and the procurement of the solution that have been co-created. But I would really love to leave the floor to them, because they really work quite hard to move, as you said, from the co-creation and the pilot into the procure solution and really adopt that into the system.
And if I can add to that, procurement and regulations and institutions around that are important, but also creating new institutions that are aligned with all kinds of novel. So for example, reimbursement is another area in which institutions are very, heavy and very standardized, but they also in some cases there need to be new routes or alternative routes for some categories of products. For example, e-health products, digital innovation in healthcare, digital health innovations. They call for different kinds of reimbursement routes in order for markets to form. So it's also not only about procurement, but also sometimes about creating new mechanisms through which the demand and supply can be exchanged, so to say. And that's because healthcare is so heavily regulated, that can also involve institutional entrepreneurship, so to say. Yeah.
Yeah.
Unfortunately, we are running out of time today, so I would invite everybody to eventually get in touch if you would like to continue this conversation. Personally, I would thank you both very much for your inputs. I think it was a perfect introduction to the whole CHERRIES program in a way, and also to the webinar series that we kick-started today. As you anticipated, some burning aspects, burning questions that we hope will be able to maybe not answer, but for sure will address with other experts and practitioners in the coming weeks. So Miriam was anticipating the one on the ecosystems. Next week, we'll be talking about ROI practices in healthcare. And please check the timing. We changed the timing. It will be starting at 12:30, so at lunchtime. And then there will be other 2 webinars following in October. One is about the role of procurement in healthcare innovation. We spoke a little bit about it already today, but and indeed Oulu University will be a representative of Oulu University Hospital will be there to talk about this innovative approach they have developed. They are developing in order to align indeed co-creation processes with the procurement practices and policies. And the 4th webinar will be about regional innovation ecosystems for healthcare. So really the importance of the ecosystemic approach to the healthcare sector. So so I would invite you to follow us on Twitter, LinkedIn, so to be up to date with our activities and initiatives. We'll be starting quite soon with the regional activities. So you will hear about concrete stories from Murcia, Cyprus, and Örebro on how we are going to implement this co-creation and ROI-driven approaches to innovation in the healthcare sectors. And I invite you to check our website and subscribe our newsletter to receive every 2 months or so some updates from us. So we won't be spamming you, we promise. So I would thank again very much Miriam and Wouter for his talk, for their talk. Thanks a lot. We couldn't ask for a better introduction. And of course, I thank also Stefan for being with me on this session, and all of you for having attended it. Again, register for the next sessions if they sound interesting to you, and I would ask you to take really 2 minutes, 3 if I exaggerate, to answer a short feedback survey, so we can improve our offer and our next online sessions. So thank you very much. Get in touch, and well, see you soon.
Okay. Thank you.
Thank
Bye.
you.
Thank you.
Bye.
Bye. Mm-hmm. I have to find how to close it. Where is it? Okay.